I really also think that the governments and authorities, they cannot necessarily fast track just because of fast. It will take some time to test it. But one thing that is happening, and maybe it's happening tomorrow, we don't know, but of all of you working within the EU, that the MDR was supposed to go into effect in end of May, and maybe tomorrow it looks like that the European Union or the European Commission will actually postpone that for a year, so that we still only have to comply to the MDD, which is a much less strict, directive. So it's from the directive to a regulative. And that will maybe be public tomorrow. We're not sure yet, but if that happens, we actually gives a year to have a little bit less regulation, and that's a fast track in itself, I would say.
Thank you, Cristian. Do you want to give us your perspective?
Yeah, I think that, as I said before, again, we have a lot of things to do before we do new things. We have a lot of solutions that are already regulated and they are not in place. I think that healthcare has been a physical business even today, and it is a physical business. And there's a lot to do with virtual care and telemedicine and devices and all these. Now it's obvious that we need it more than ever, because people is not going to the hospitals because they are afraid to be contagious about COVID-19. So you need to do the remote care, which in many countries is not available in a regulated way. And even in Spain, it's not clear, the regulation. You are not able as a physician to prescribe anything to anyone that you have not seen before. And that, it's obvious today, that makes no sense. And we have a lot to do. I think an easy way to advance is with telemedicine. And it will be a huge impact in healthcare, because it has been the technology there for 20 years, but we haven't really made it. And I think that the big shift that we should do is to allow a broad spectrum of telemedicine, always taking into consideration what should be done and what not, and setting the borders for that. But of course, I would change right away the regulation regarding telemedicine in many countries.
Thank you. Eduardo, your intake here.
Yeah, and I think this is such an interesting topic because, and of course, fast tracking has been there for decades now. So when you have, like, for example, a rare disease, you have several mechanisms for drugs to be developed faster and to be implemented in the market faster. So we should not be afraid of that, of course, with the rigorous process that these agencies are able to conduct. But I think what is most interesting is what Cristian just said about the other side of the regulation, not fitting drug development or a medical device development to the current regulation, but also developing new regulation to assess what's being done right away. For example, in Portugal, as you know, we have several initiatives, patient-directed initiatives that collect symptoms and they provide advice, and they're not medical devices. And how can that be done with the dangers that are surrounding it? And we think that this new area needs to be regulated as we go and as we face it. And this is a huge opportunity for us to see live what are the implications. And for example, symptoms checkers are just a part of it. For example, as you said, telemedicine has been there forever. And in some countries, they still can do it and can prescribe. Of course, in Portugal, we're lucky that we can prescribe a drug anywhere with our cell phone. But there are some countries in Europe that cannot. And of course, I see this much more interestingly in the side of we can develop new regulation right now that eases this process and makes this process available, particularly not on the development of solutions, but on the processes that are being implemented for patients.